Hi, welcome to Functional Fridays. I'm Dr. Sherry Jacobs, naturopathic doctor, certified nutrition specialist. I'm with Shannon Kennedy, internal medicine doctor. And we have, unfortunately, over the past couple months, have had a few patients show up with shingles.
Yes.
And if you have ever had shingles or you know somebody that has shingles, it is just awful. I mean, people will describe it as the worst pain and the worst fatigue they've ever had, and it takes a long time to go away. And so it was it's a hot topic in our minds right now, and I think it's stemming right now from this excessive level of stress that everybody's under.
Yes, they're literally, hiding inside their homes from the virus that's out there, and meanwhile, the stress has brought out a virus that has been sitting in them since childhood. And it actually opens the door to a lot of conversation about what people are going through when they come in, and they're like, "Why is this happening? I'm doing everything I can to stay healthy, and you can't hide from the shingles. It's inside of you, but you certainly can do things to prevent or to make it less likely to have outbreaks by controlling stress." But more importantly, since we can't always control our stress, is to recognize the symptoms of shingles so that we can treat early. The earlier we treat, the better the outcome.
Absolutely. Yes, catching up what we call the prodrome period. So what are some of the symptoms that come in that prodrome period?
Sure. Certainly for the first time someone has shingles, we almost never catch it before the rash outbreaks because we're just so unsuspecting and we don't really know. As long as you've had chickenpox as a child, you are at risk for developing shingles. But people will have initially like a tingling or numbness, or what we call paresthesia in the area of the body where the shingles are going to, after about 3 to 5 days, break out, and then it's obvious what it is. It's always on just one half of the body. So if you have those symptoms on both sides of your abdomen, or both sides of your back, or both sides of your face, then definitely contact your doctor. But don't. But it's not the shingles. Shingles present in a dermatome, where your nervous system, your nerve comes out and innervates one half of your body. So it might present from the middle of your back all the way around to the middle of your front, but it won't cross midline. So that's one thing, is to recognize just the numbness, tingling, sometimes even like an itching sensation, and then it very quickly progresses to pain. And so some stories that I have with shingles are working somebody up for chest pain on their chest, where we think they're having a heart attack, and we work them up and it's not a heart attack, thank goodness. And as they're leaving the hospital, I had one patient say, "Those leads that they put on my chest for the EKG gave me a rash. I'm allergic to those leads. I'm allergic to the tape." And I looked at it as shingles, which I was like, "Oh, shingles, it's great. It's not your heart, it's just shingles." But that's something. Another person worked up for diverticulitis, again with left lower quadrant pain, and the CT scan was negative, and they were in so much pain though. There's writhing in pain, and then the rash breaks out. I'm like, "Yay, shingles!" So it's nothing that's going to
Shingles unless you have shingles.
Right. And at that point, we start them usually on an antiviral medication. But then once they've had shingles and they know what to look for, as soon as they experience the feeling of the numbness, the tingling, the itching, or the pain before the rash breaks out, it's important to start either the antiviral medication, or there's some real natural approaches that are very effective.
Yeah, we do. We look at what we call lysine-arginine ratio, and so we have people do higher doses of this amino acid called lysine, and then we take out some high arginine foods, which can definitely exacerbate some kind of herpes flare, because what do we love to eat? Nuts and chocolate. And chocolate, and you can, especially when you're feeling stressed, what do you go for? Chocolate. So if you're already feeling stressed and you're prone to virus, and you can have an outbreak by having too many arginine foods and not enough lysine foods. That's something dietarily we can do. We do definitely see a decrease in one of the issues with shingles too is that you get these lasting residual pains, or you can, and that's very disconcerting for people. So B12 injections particularly can be very helpful for that, and preventing that sort of long-standing, after the rash goes away, still having the pain.
Yes.
So when we have lots of, what I love about the toolkit in natural medicine is we have a lot of herbs that act as antivirals, and so they can be very effective and very helpful. And again, it's all, with any kind of infection, it's all about catching it early.
Yes. For people who are really, adverse to taking medication, it's nice to have those, if you're prone to shingles, to have those antiviral herbs on hand. That way, anytime you have a little itch, a little tingle, you think this could be shingles, it's very safe to start those, as opposed to initiating, a 7-day course of a big blue pill of Veltrex, which, of course, all medicines have side effects. So it's nice to know, if you are prone to shingles, to have those herbs handy in your house to start right away if you suspect shingles coming on. And then, and you mentioned that some people have pain for a long time after shingles. So we hope by the 6-week mark that all the symptoms are gone, but some people will carry what we call post-herpetic neuralgia for months to years after shingles outbreak. And that's why I think the shingles vaccine for some people, you know, is a good idea. So it's something you can ask your doctor about.
Absolutely.
Yeah.
All right. Good luck.
Yes.
Don't get shingles.
Stay calm.
Right.